having me on the show, and I think this is a very relevant topic since right now about 70% of Americans are overweight or at least dealing with some aspect of weight issues. 25 million are diabetic, and they expect that even more so will occur in the next 20 years. I think they're estimating by the year 2050 that a third of our children will be fighting diabetes if we do not find a way to deal with the obesity epidemic. So the HCG plan is a way for people to begin to restructure their eating habits and to establish new lifestyle behaviors that help them to maintain a healthy weight. And the HCG itself, it does involve a diet, but the key on the HCG is to use a natural hormone to help reset the hypothalamus. This is the part of the brain that regulates the body's body fat and muscle mass. And what happens to people who get stuck in being overweight is that they have so much visceral fat that causes inflammation and insulin resistance that they actually get stuck. And you hear all too often that people say, I've tried this diet, I've tried that approach, and I just cannot lose the weight. And what the HCG does, and this is a prescription-based HCG, not the homeopathic, it will help people begin to switch that hypothalamus around to where they can experience success in losing that visceral body fat and then help them rebuild their muscle mass.
So what are you going to say to all the naysayers? And I'm going to say that there have even been some pretty big guns weighing in on this. The British Journal of Clinical Pharmacology, the American Society of Bariatric Physicians, and even the Food and Drug Administration have said that this doesn't work.
They are talking about homeopathic. You know, homeopathic HCG was recently, they're going to start trying to take it off the market. And from the very beginning in our program, we have basically advised people not to use homeopathic HCG because the original Simeon's program, which, by the way, the research that actually followed his approach, there is a successful research article out there. Plus, we have published research data showing that it does indeed result in weight loss and reduction in cholesterol and triglycerides and blood sugar. And we have over 300 participants who have experienced tremendous success in using the HCG as a means of getting their body composition back to a much more healthy place. So I know what I think there's just a lot of confusion because a lot of people have kind of marketed HCG as kind of like a miracle drug or like a appetite suppressant, and it's none of those things. It has to be used as part of a comprehensive, structured, medically supervised weight loss program where the emphasis is on establishing goals for a better lifestyle and better eating habits.
Well, I really like that you do bring that in because people who relapse, if we want to call it that, or go on a diet and the next thing they know they've gained it all back plus, sounds like is being addressed in your program by helping them, as you mentioned earlier, to even restructure their eating habits. But the question I have for you is this diet. Let's talk a little bit about this incredibly low caloric diet that you have in conjunction with the HCG. Tell us about that.
Well, originally with the Dr. Simeons, who was the doctor that did the original research on this in the 1950s, what he found, he was working as a tropical medicine specialist in India, and he found two groups of people that lost significant. Well, actually, one group of people lost weight. They were a group of teenagers who had a pituitary disease that caused them to be overweight. And they found that if they gave them HCG, that it would change their body back into a more normal body composition, and they would lose weight without losing muscle mass. The other group of people that he noticed was that there were a number of pregnant women in India that they were small, they weren't eating all that well, but yet they would have normal-sized babies. And he he reasoned that somehow the HCG that that was being produced by their bodies was allowing them to burn the hidden body fat rather than using up muscle mass, and that's the biggest problem that I think we run into with most diets, low-calorie diets. And and I have to tell you, Joan, that for many years patients came to me and said, "Can we do HCG?" And I said, "No, let's not do it because it's such a low-calorie diet." Because Simeon's originally came in with a 500-calorie diet, and that is the traditional HCG diet is 500 calories, and it's true if you're just going to go on a diet and go 500 calories, that is dangerous, and it can cause you to have heart arrhythmias, and you can become dehydrated, you can get into depression, fatigue, all the things that you hear about that when people try to just go on a strictly low-calorie diet.
And I'm really glad you brought that up too, because it's just like we know the homeopathic formulations are leaving the market. That's been an FDA came out and made them illegal. But people who are at home trying to do this without someone such as yourself and the folks at your clinic medically supervising, people need to realize, just as you said, this can be dangerous. This can be potentially fatal. Have there been any deaths that you've known that have occurred from the folks out there trying to do it on their own?
Well, I don't know. I see, again, the part of the confusion is that people will say I'm on an HCG diet and they're using the homeopathic forms, and as far as I can tell, that'd be pretty close to the same as just being on just the 500 calories without any true restructuring of how your hypothalamus is using those using those low calories. See, the whole key that Simeon discovered is that when you put the body on a low-calorie diet but have the HCG on board, and that's at least 125 units, and in a homeopathic dose there may be less than a thousandth of a percent of 1 unit. It's almost nothing, and so that's why it doesn't really work. I mean, it works for some people, but it works because it's such a low-calorie diet. But the reason HCG is successful is that the hypothalamus begins to draw upon visceral body fat. So you're eating 500 to 700 calories a day, but your body is burning an additional 1,500 calories of body fat. And people say, well, how do you know that? Well, that's the medical structured part of what we do. We have people come in every week for body composition testing, and we follow their muscle mass and their body fat and their body water to make sure they don't become dehydrated. And we track we do blood testing ahead of time to make sure they're not low potassium or have other electrolyte imbalances that could put them at risk for arrhythmias or things like this. So I think the medical supervision and the fact that the emphasis is on lifestyle change rather than just on diet is a key part of the success of our program.
And I have to ask, too, do you see more research being done on this product for weight loss?
Well, we actually, like I said, we published research just in the last month, and so we ourselves are a group that's researching it. I think most of the people around the country are just utilizing it as a weight loss program, and I don't know how much new research is being done. The Azure studies that I'm referring to was published about 20 years ago, and it did follow the Simeon plan, and it was a double-blind study, and it did show significant weight loss. But most of the other studies, what they did is they kind of semi-mimicked what the Simeon plan was, and then it did not show reasonable results. And so that's where a lot of the people will say there's no research. Well, there is research, but there's not a lot of research on the HCG plan.
Exactly, and I think that's going to be something that's going to be needed to validate, the medical supervision and the medical use of this diet plan. I know I just saw it on CNN, they had a medical doctor talking about the program, and she was actually even saying that, she is working with the program she's doing to do more research. I think some of the things she was looking at is, just like you've said, Dr. Ron, that, the homeopathic units, the amounts of the active ingredient in those compounds isn't what you as a physician can prescribe. And she was also saying, too, that they're at the point of trying to check with the prescription levels. You know, do they need to increase those? Do they need to change those? Are you sort of in the process of evaluating your results and
yeah, we are. We
continuing to tweak the program, so to speak?
We have tweaked the program. When we first started out, we were at just 500 calories, and now we're up to about 750. I'm sorry. And what we've done is we've added additional protein at breakfast, and we've added additional vegetables. Plus, we have an entire lifestyle. We actually have 3 books that we give our patients. So this is a re-education program. They have a tracking book that they bring in. They keep track of everything they're eating and how they're feeling, and they bring that into our nurse educator every week when they come in to see her. We also have a secondary book that gives them all the basics of the program, and it includes the research that's been done, how the program works, the science behind it, the issues that they might run into. And then we have a new book by Dr. Hyla Cass, who is an MD that wrote a book called 8 Weeks to Vibrant Health. And each week they're learning additional lifestyle activities, such as how to deal with emotional stress, how to get a balanced exercise program in, how to do some safe detoxification. Hormonal balance turns out to be very important in this. Mm-hmm. So these are issues that we're bringing in so that we look upon our program as a lifestyle transformation, not just another diet, but an opportunity for people to take advantage of the fact that when they, and I will tell you this, my wife, for instance, has lost 52 pounds on this program.
Wow.
And I can't tell you how enthusiastic she is because she has tried so many different things that didn't work for her, and she did not, and whenever she did try, like you hear a lot of people, they'll go on a diet for a week or two, they'll lose 2 or 3 or 4 or 5 pounds, and then all of a sudden they have to go to a party. They don't really know how to handle themselves there, and they end up regaining the weight back, and they feel very, very frustrated with that. Or they'll go on an extended weight loss program and lose weight, and then they'll have some major stress come into their life and then gain all the weight back.
Well,
so
Dr.
our goal
Ron,
is to actually help people anticipate these kinds of events and to know what to do in order to not have that happen.
Well, Dr. Ron, that's one of the reasons we're doing this segment on weight loss, because as you know, New Year's resolutions are coming up and people are thinking about, making those changes. But you're even giving your program would, even if they had been on your program, would help people cope with the holidays here. So we're going to have to take a little bit of a break with Dr. Ron, and we'll be back to talk some more about this very interesting subject, the HCG diet. You're listening to Joan on the Joan Jerkovich Show at 910 KINA Salinas. Stay tuned. A little stop. Dr. Ron, what would you maybe like to hit on the next one? We have had him already record a segment. We've got that in, and he's kind of sitting here. I said, jump in, but I knew you and I were just going to get going strong. But he's already had some really good things to talk about with, this visceral fat and, just various things that, you even mentioned. And there's nothing like somebody who's had the kind of success he has to, really bring it home to the people. So Dr. Ron, what do we want to hit in this next 14-minute segment? They seem to go fast, that you think's important. You're better at this than I am.
Understanding what's actually going on, that weight is not a single cause. There's multiple causes that people in their weight dilemma. And so what we're trying to do is create a program that addresses it on many different levels, but unless it can actually help people successfully lose weight, you can't get their attention. And so there has to be something that helps them get over the hump and to lose, because with this HCG, people typically are losing 2/3 to 1 pound a day.
Yeah, right.